So we've put together a group of panelists, technologists, and industry experts to not just share what they know, but to really catalyze the discussion today and beyond for what the American Heart Association can do as a bridge between technology and health.
The American Heart Association is so committed to helping to expand the field of technology in health and in healthcare. We recognize the critical importance of connecting individual consumers and patients with the healthcare providers and their system. And we believe that by innovating new solutions, whether it's for the management of patients in a care setting or for individuals to manage their own health and their own care, we can make a tremendous difference in the outcomes of health in America.
Health technology can be tied to improving health outcomes in a lot of ways. Number one of which is that we're going to need data, we're going to need information as to how best to take care of our patients and how best to take care of a population of patients. Secondly, we're going to use technology to potentially influence how we all behave in terms of things like improving our blood pressure, stopping smoking, eating better, lowering our cholesterol. And then maybe finally, technology is going to be a way that we can follow up with each other. And I specifically didn't say patients follow up with providers because I think it's going to be a lot more bi-directional than that. We're going to have providers following up with patients, patients following up with providers, patients following up with other patients group, and I think that technology is going to facilitate a lot of that. And my belief is that, and the evidence I think is consistent with showing that that type of connectivity will help improve patient outcomes.
The most important things of this conference, the ability to bring together the technologists with clinicians who are delivering care every day. When they work together, that's in fact where the best products are developed, and then those best products are implemented into routine clinical care.
Right now we know that about 1 in 3 people look up health information on their mobile phone or things along those lines. So we know that people are using technology to access information about healthcare. So what we're trying to figure out here today, and in terms of other thought patterns, is how do we best use an evidence base between science and what we know to help people make the best decisions about their own health care.
So health technology and mobile health is very, very important to improve outcomes. We actually know this already because we've used these technologies for over 15 or 20 years to manage some conditions like heart failure and heart rhythm disorders in a clinical setting. Where we're going now is to move beyond the sickest patients we treat and to look at patients who have cardiovascular risk factors but want to reduce them and improve overall health. The solution to disease management and preventing bad outcomes thus far is to often see more people more frequently or call them more frequently. And what we hope we can do with a lot of these digital tools is to streamline that process, get the data, and prevent the bad things before they happen by recognizing that they're about to.
As this meeting was first germinated, when you really did plant the seed, and what were you thinking about? Is that the mix you were looking for? Were you looking to connect providers and technologists?
Absolutely, Bob. Thank you for that question. We absolutely were. One of the great things about the American Heart Association is under our umbrella, we have lots of different specialists. We represent consumers, patients, and we have been working very actively in the health technology community. And so we thought to ourselves, gee, if we could just create a forum where everyone could come together and we could really dive into these issues that are so important and that need to be thought through, perhaps that could be a way we could make some breakthroughs in getting things moved on to the next area.
Health technology is important to me for a couple of reasons. On a personal level, it allows me to understand more and take a little more control over my health on an individual basis, to communicate with my clinician, or to just through applications to be able to track my health. I think probably more importantly for me and my work on a system-wide basis, we believe that health technology will allow us to reduce costs and to get better outcomes. And in doing that, we'll be able to help clinicians to have more information on their patients and a more holistic view of that individual. On an individual basis, we'll be able to understand more about our health conditions, to be able to track our progress, and to be able to overcome gaps in health literacy instead of just going to Dr. Google, to be able to use other tools to get a wider view of what's going on with me individually and how I can help resolve that myself.